Hello, my name is Josefina Pope. This is my macro planning presentation. My target population is older adults, specifically elder abuse. Elder abuse is a social problem that robs seniors of their security, dignity, and in some cases, their lives. The National Research Council describes elder abuse as intentional actions that cause harm or create a serious risk of harm to a vulnerable elder by a caregiver or another person who stands in a trusting relationship with the elder, or failure by a caregiver to satisfy the elder's basic needs or to protect an elder from harm. Older adults are vulnerable population because of social isolation, mental impairment like dementia or Alzheimer's, and their dependence on others. About 5 million older Americans are abused each year. Elder abuse includes neglect, abandonment, and financial, physical, and emotional abuse. Neglect is, once again, we go back to when a caregiver is neglecting to satisfy the elder's basic needs, such as food, just keeping them clean. And abandonment is when a person leaves the elder adult to care for themselves, and they are unable to care for themselves. Financial abuse means the misuse of or withholding of an older adult's resource by another. Physical abuse means just inflicting physical pain or injury upon an older adult. Emotional abuse means verbal assaults, threats of abuse, harassment, or intimidation. And sexual abuse means touching, fondling, intercourse, or any other sexual activity with an older adult when the older adult is unable to understand, unwilling to consent, threatened, or physically forced. Studies have found that at least 1 in 10 community-dwelling older adults experience some form of abuse in a prior year. 10% of Americans over the age of 60 have experienced a form of elder abuse, and about 60% of that elder abuse and neglect comes from family members or caregivers. A 2017 self-report study assigned the percentages of the abuse as psychological 11.6, physical 2.6, financial 6.8, neglect 4.2, and sexual 0.9. The context and what I have learned is that as many as 2 million elders are abused in the United States, and the factors that contribute to becoming a perpetrator of elder abuse include individual, relational, and societal, which means that individual could mean that the caregiver could also be dealing with some mental illness, issues with drug and alcohol, have experienced traumatic events or disruptive behavior themselves, have high levels of stress, have had poor training or caregiving responsibilities, don't have adequate coping skills, or have been exposed to or have witnessed abuse as a child themselves, or are dealing with social isolation. Relational risk factors include high financial and emotional dependence on the elder, past family conflict, or a lack of social support. The societal risk factors are more for institutional settings where there's staffing problems and lack of qualified staff, or staff burnout or stressful conditions, or a lack of sense of community where the residents don't feel connected with each other. Elder abuse can be prevented, and as a whole, as a society, we need to make greater efforts to ensure that all older adults age with dignity. Evidence-based interventions include social support, adult protective services, long-term care, ombudsman, awareness, education and training, financial management, restorative justice and policy, kind of like the Older Justice Act in 2010, trauma enforced response, service advocacy, elder mediation, shelters for older adults, and the ones that I have in orange are some of the interventions that could be applied to other populations. The theoretical perspectives in elder abuse, while there's no real consensus, there are a few models that have been used for research. The ecological model that, include the individual age, sex, and their health, their microsystem, which includes the family, peers, their mesosystem, like the church service, and any kind of services that they need, and the ecosystem, which is a culture and ideology. Abuse intervention model, which is a model that integrates the multiple factors associated with the risk of elder abuse and neglect in adults, sometimes with, specifically with dementia and their caregivers. The stress process theory predicts that elder mistreatment leads to declines in health and that social support buffers its effects. And then we have the trauma-based theory when we realize the widespread of impact of trauma and understands the potential paths for recovery. We recognize the signs and symptoms of trauma, and we try to respond by fully integrating knowledge about trauma into policies, procedures, practices, and then we resist by trying not to re-traumatize the older adult. So as an overview, elder mistreatment comes in the form of physical abuse, psychological or emotional, sexual, financial, or neglect. The impact of mistreatment can range anywhere from psychological trauma to even death, depending on the abuse and the health of the older adult. Risk factors are limited, social support, poor physical health, cognitive deficits, and dependence on others, also the most prevalent. Factors for perpetration can be individual, relationship, community, and societal. Evidence interventions come from the framework such as the ecological model, the abuse intervention model, trauma-based theories, and stress processes theories. And some of these interventions and some interventions that we talked about can also be applied to other populations. This is the macro intervention and planning on older adult communities, specifically Older Adult Community Center for Wellbeing. In my community center, the stakeholders would be the community, the older adults and their family, Social Security Administration, employees, and the Department of Health and Human Services. Community tensions and opportunities. I don't see a lot of tensions because it's not going to change the community as a whole, but there's definitely opportunities like education, awareness, training, advocacy, policy, mediation, research, and mental health care. As far as political context, what I know is I'm aware of the Elder Justice Act of 2010, which is the first comprehensive legislation to address abuse, neglect, and exploitation of older adults at a federal level, and the Older Americans Act, which offers funds for critical service that keeps older adults healthy and independent with services like meals, job training, senior centers, health promotion, benefits enrollment, caregiver support, transportation, and more. Target for change for the center is for older adults to try to fight elder abuse, and positive change looks like informed and educated older adults and families, greater mental physical health care for older adults, greater support for the aging, proper respite for caregivers, more social services and resources for advocacy and caregivers, and stricter laws against predators. And voices are being heard through advocacy, policy, and community awareness campaigns. So my intervention strategy includes social support, education for the caregiver and the older adult, and tough punishment for the abuser, which will deter the elder abuse, since the caregiver will know how to care and deal for the older adult in tough situation. The caregiver will also be aware of the tough punishment if there was abuse involved, especially since there will be continued welfare checks. People involved once again and who will be assisting would be the caregivers, community health workers, adult protective services, Department of Justice, policymakers, and the community and adult advocacy groups such as like AARP to advocate policymakers. I think that all of those groups can contribute to the center. As I said earlier, the asset strengths and resources are the community advocacy groups, the Elder Justice Act of 2010, Older Americans Act, Department of Justice, Adult Preventive Services, Social Services, and Social Security. And the theories that would guide the center and intervention would be the ecological theory and the abuse intervention model. The goals of and objectives and evaluation include to educate the community, to caregivers all about elder abuse and understand the warning signs, deter caregivers from potential abuse, and promote overall well-being for adults. Evaluation will work in a way where there'll be home evaluations and throughout the community surveys, medical surveys, older adult records, and survey community resources for potential needs. Potential challenges are just the lack of resources due to resources being used during COVID-19 pandemic. In conclusion, elder abuse is prevalent and is often unreported. 10% of older adults are abused, and 60% of the abusers are caregivers or family members. I want to open a community resource center that includes community health workers, advocates, educators, medical and mental health workers, and law enforcement all in one place. The center would educate caregivers, do welfare checks, offer resources, advocate for the abused, and punish abusers. The center will also be a community hub for centers services such as Social Security, government assistance, Medicare and Medicaid, and funding would be going through government and corporate grants, community fundraising, and private donations, and the center would be sustainable because the services offered would continuously meet the needs of the aging population of the community. Thank you.